Now I would like to speak to you about our next speaker, Thierry Gouzland. He is the president of the AROM, the French Association of Orofacial Maxillo Reeducation, Rehabilitation. He will speak to us about the importance of oro-myofunctional assessments and the use of a score as a tool for interdisciplinary communication. It's a tool that he was developing and that is allowing different kind of procession to base themselves on the same tools to be simply speaking the same language. Because when kinesiotherapists, speech therapists, orthodontists, sleep doctors are speaking about myofunctional disorders, how to know exactly how to evaluate all of that. That's the topic of his work since many years. He was recently releasing this new tool that everybody can use for every scientific study all over the world. And he's also releasing a journal, a scientific journal of l'AROM, available in French. That is Thierry Gouzland, and he is going to show you all of that right now. Thierry, it's your turn.
Thank you very much, Guillaume, for this presentation. Thank you for inviting me here for this International E-Congress. It is an honor to be here. And today I'm going to talk about this little tool that I developed a few years ago. It is an assessment, if it is an assessment tool, an oro-myofunctional assessment tool. And this is interesting because we know that the rehabilitation is used in numerous treatments for facial growth, sleep apnea. But in order to have an efficient treatment, you have to have an efficient assessment protocol that will allow you to have the appropriate criteria. Another element that motivated me to develop this tool is the multidisciplinary nature of the work. We have different teams and we needed a common language, a common assessment, and a common exchange tool. So often the problem is said to be the tongue. And you will see that this assessment tool will assess beyond the tongue. Even if, of course, this is a perturbation element, we have solutions and the score is included in it. We also have other tools that gather us here today, tools that help us to manage and treat those patients, and we will discuss it further lately. In a bit. Another important element in the development of this tool has been the following. Until now, the assessment has been very subjective, and it wasn't based on specific criteria. So I wanted to develop this scale in order to have an objective and significative tool that will allow us to have a number related to the patient's state. This allows to share our information between different teams. It allows to make studies, and the patient also loves to see the progression of their score. This allows to structure a treatment and to do studies and research and to be objective. So how does this score work? So many people who use this assessment tool, okay, it is called GOS. So it is called GOS 12, and G stands for Gouzland, for my name. It is a severity score, and each criteria is based on a dysfunctional criteria. So when it's dysfunctional, the score is 1, and if it is healthy, the score is 0. So I separated the score in 2 halves. So we have 12 numbers that separate the score, and on one side the structural score and on the other side the functional score. So now I would like to show you the different elements of this evaluation tool so that you can better know how this tool works. So the first part is dedicated to structures, and so first of all we are going to analyze the anterior posture of the tongue. We know that the apex of the tongue, the basis, has to be well spread on the palate and to the lips, and the lips have to be together without any effort and no contracted contact, and there has to be a nasal ventilation. And this is the neutral resting status. So you see here on the picture the different scores. If there is a dental compression, we will have to work it in the rehabilitation phase. Then the basis of the tongue. So here you have scores 1 and 2, and the scores 3 and 4 show dysfunctions. So if we just see the soft palate or hard palate, this is a dysfunctional state. Here you have a little exercise. Then the third element is the tie. And you can use this test, the Gillespie's test, Wilder and Gillespie's test. And here you can see, so this is a test on the short tie. So on the right, we consider that the score is 1. And on the left is the healthy status. Then regarding the tone of the tongue, on the left, if we have a right tone, all dental prints are elevated, and then on the right here you have the score 1. We see that the tongue is unable to touch the palate, as you see on the video. And at the bottom, we have a lack of maturity of the tongue. So there is a lack of control. And at the bottom on the right, we want the patient to click the tongue on the palate. And you see that the tongue is unable to do that. It goes on the side. So this is score 1. Here you have an exercise to work the tone of the tongue. Then the lips. The lips are another structural element of the assessment. So here there is no anti-version of the lips. So this neutral position is a healthy position with a score 0. And on the right, we see that there is a dysfunction on the first picture. There is an hypotomy of the upper lower lip. So when we ask the patient to close the lips, you see a contraction on the side of the lips and on the chin. So this is a dysfunctional state, and thus there is a score 1. Here you have the example where there is a labial contact, and we see the contraction of the chin and the side of the lips. So when we see that, we have to act and treat the patients. Here you have two different types of exercises that allow to lower the lower lip. And here we have another tool. And this tool gathers us here today. It is the Foggy Mouth, and it is a very significant tool that allow to get back to a healthy position of the lips. And then we were talking about TMG. This allows to evaluate the pain, the noise, and the muscle tensions. Here there is an example of a movement, and then we have the first number on a scale of 6. The second part are the functional score. The first criteria is the swallowing. So this is for the score 0 with the tongue on the palate, and there is a peristaltic undulation. Then here you see a dysfunctional state with a score 1. So here there is a peribuccal inspiration. There is a contraction of the chin, and these movements show that there is an anterior lingual pulsion and aspiration. Donc, so if there is a tension on the lips and the chin, this shows a score 1. Here there is a patient who has an anterior lateral position. We see the contraction. So when we pinch the lips, if the patient has this need of aspiration and this lack of control, and the need to suck the air in, then this is a dysfunctional state. On the right, there is a young man who can do the exercise, but not in an automated way. The movement has to be correct and automated. So here, once again, we have our Froggy Mouth. This is a very interesting tool to do a rehabilitation and correct the swallowing function, and that should harmonize all the functions of the patient. Then we have another criteria, another element, which is speech. So here on the left, we see that the tongue comes out of the teeth, and on the right, on the video, we also see that we have a certain salivation, and at the bottom we can clearly see the tongue coming out of the mouth. Here on the left, we have a young patient who is being rehabilitated. On the left, it is a score 1, and on the right, score 0. Then another element is breathing. The breathing has to be nasal. And if there is a symptom of dry mouth during the night and sleep apnea, there are 2 little tests that you can do. So there is one breathing cycle, a nasal breathing cycle. And on the left, you see that she is opening her lips and that there is a contraction. And on the right, there's a patient who is also having trouble having an entire cycle, nasal cycle. Then another criteria is chewing. The chewing has to be unilateral and painless. So in a healthy state with a score 0, it has to be painless, and a score 1 is evaluated if there is any noise or if there is any pain, amongst other. Then another criteria are parafunctions. So this is related to the tissues, to the labiophagy, noises, amongst others. And the last criteria is the posture. So regarding the score, we are evaluating the cervical posture, the position of the head and the neck. On the picture, you have the interconnection between the bases of the head. So here you see the posture on the two pictures, and Fabio Scopa researched the posture and established the link with the breathing. So we are analyzing the position of the head and the neck, and then we base the evaluation on two numbers. The first one is the structural and the second one the functional, and then so we have a score with two numbers, and these two numbers allow us to structure the treatment with a tool that is easy to use, especially for practitioners who need practical tools and who have this assessment tool that allows to have a common language base for all practitioners. So even for other healthcare practitioners, they can use this score to know exactly the importance of the dysfunction. So we have an objective value of this dysfunction, and this allows the practitioners to study, to do researches, and to motivate the patient who can see the progression of their score. And this allows to have objective diagnosis too. So here with the patient who has an orthodontic treatment, you see the score at the bottom on the left, and at the top left we also have the structural score. On the right there is a TMG disorder, and here we have the score structural at the top and functional at the bottom. And here are the numbers for severe dysfunction. So here we have a context of severe dysfunction for this patient, but there's also a structural bone dysfunction, and they will need a surgery. So here we can see that the score has different scales and shows the reality of the dysfunctions. So this evaluation tool is used more and more by different professionals in France. It has been translated in Italian, and it is also used in Asia, in the US. And so it is used in a universal way, and it is at your disposal. You can use it, and I can send it to you with the explanations so that you can use it. So I thank you very much for your attention, and I hope that these elements gave you an additional tool that will be useful within your practice. And I am sure that these Froggy Days are a success, and that this is the beginning of a great collaboration and the beginning of many projects to come. Thank you for your attention, and I remain available if you have any questions. Thierry, thank you very much for your presentation. A very quick question. I think that many people are wondering, at what score do we consider that we need a rehabilitation? 1, 3, 4, which score? Of course, 3 out of 6 is an interesting score. It is the basis of what will determine if there is some rehabilitation needed or not. So the score, as I told, is a global clinical picture, and we need to take into account the patient too. So the practitioner is going to have to use their own judgment. So right now we have some studies that will show some values, but for sure, the more people we use this tool, the more we will have statistics that are going to enrich it. So I remain available if you want to contact me. If you have any questions, I am here on the platform. Don't hesitate to contact me if you need more information or if you want to participate to any studies. So see you soon.
Thank you once again, Thierry, for this lecture. It is very important, I think, to say how important tools like that, to have a score that different professions, different practitioners from different countries can agree about how much it is important, because there is no real test like that on the literature that is evidence-based and that is making a consensus that everybody can be using. So that's why having also French people having the courage to launch a new tool like that to help the collaboration, international collaboration between countries, between different fields to work on the myofunctional disorders, it's something very important. Thierry is very open to speak to about that to everybody that would like to use that in scientific studies. Making tools like that is really having one point: making scientific studies, helping the research, and making the myofunctional research going further. So that's why you can all contact Thierry if you are having any question about that. And of course, I'll ask all the questions that you might have on the Facebook group, like for all the other speakers. Thank you so much, Thierry, for that.